I'm going to talk to you today about dentures and the care of dentures, just a little brief guide, whether they're your own dentures or whether they're someone that you look after and care for. Particularly in a care home, you're going to need to know who wears dentures. Often that's obvious, but you can be confused if people have just a few teeth on their denture. You may not spot it, so you need to know that from your initial assessment, whether they've got a denture or not. There's two types of denture. There's the full denture, which replaces all the teeth in the jaw, and there's a part denture or partial denture which fits round the remaining natural teeth. They're the two basic types, full denture or partial denture. They both need cleaning every day, and ideally they should be removed at night. Some patients, residents may be resistant to this, and some will look after their own dentures, but you should be encouraging them to take them out every night, otherwise it can lead to soreness under the denture, redness under the denture, or increases the risk of decay. The cleaning of dentures is absolutely vital, so when they're out of the mouth, you want to be using a denture brush. That's the crucial thing. Not a normal toothbrush, but a denture brush. It's tougher, it's a bit closer to like the strength of a nail brush. You can always use a nail brush if you haven't got a denture brush. And it's designed to go inside the denture. The most important place to clean is in the grooves, the inside surfaces of the denture. You can just use warm soapy water over a bowl so you don't drop it into the bowl, because you can shatter it into a bowl. You want to have the bowl, or whether it's a wash bowl or a little bowl, warm soapy water, and scrub away quite vigorously inside the denture to get off all the debris and the food and the film of plaque. And then rinse it under cold water, and then ideally into a denture bath, which again, just fresh water overnight. You can soak it in there. You don't need to be using Sterident every day, although Sterident is useful for people who are smokers or who have a lot of scale forming on their teeth. Sterident's quite strong, so I wouldn't use it on everybody every day. Just select which patients need it. But the main thing that people forget is to really scrub it. A lot of carers will just rinse a denture and drop it into Sterident overnight, but they're missing the most important step, which is the scrubbing. You've got to really scrub it, otherwise you're leaving all the film and debris in place. The cleaning of a partial denture is particularly important because, as I said, it fits around all the natural teeth. And if you don't keep a partial denture clean, the plaque that builds up is going to cause decay and problems in the teeth that the denture is relying on. So it's obviously going to lead to pain, the teeth will break, and then the denture won't fit anymore. So when the denture is out, as well as cleaning the denture, you've got to obviously clean the teeth that it fits around, because they are retaining or holding the denture. So partials are even more crucial in their cleaning and removing than full dentures, which obviously there's less risk because there's no teeth, nothing's going to decay. You're only going to get soreness of the gum. In the morning when you're refitting a denture, most people will do that themselves. Obviously a resident who's confused or lacks capacity, you've got to do that for them. A full denture is usually very easy to put back in. Sometimes you get a bit of resistance just because the patient, with their muscles, it's a bit uncomfortable to do it, but usually it's not difficult to place the full denture back in. Fitting a partial denture back in can be a bit trickier. Sometimes there's wires or clasps that go around the teeth. Usually you need to know how to fit that denture. Again, it's not difficult, and if it's a particularly challenging one, usually the dentist will have advised you how to do it. When you're fitting the denture back in, or the patient's putting their own denture in, just see if they're showing signs of pain. Usually they'll tell you, or it'll be obvious, they'll be wincing or making a noise if it's become painful, because that could be a sign that the denture is actually hurting. Particularly with a new denture, that's something to watch out for. If they've had it for months or years, usually that's not an issue. But always be aware if they're sort of behaving differently on inserting the denture. The majority of dentures should not need fixatives, but having said that, there's a lot of patients and people who do need a fixative, particularly if the denture is really old, or they're using an old denture that can't be replaced because of their dementia, and they're coping with something that is inadequate. And some people almost get addicted to fixative, they just won't go without it. They're all fairly similar, I won't go into the different products, but the main thing about it is to use it sparingly. Almost every time, if a carer is not trained, they'll put too much fixative into a denture. You really just need to use a few little strips or a few little spots to secure it, unless it's a very old denture which has huge gaps underneath. but generally try and just keep the fixative amount to a minimum. Otherwise, you'll find that it just clogs up the mouth. It's a bit of a nightmare to clean off as well, so it's in your own interest to keep it to a minimum. Try and wipe it away with a tissue, and then you've got to use warm water and more tissues to get the fixative off. You need to remove the fixative at the end of each day, otherwise it will just accumulate into the mouth. Right, that's an overview of the maintenance and care of dentures. So if you forget everything else, just remember to take them out each evening and to really scrub the surface with a denture brush and leave them in water. Then you'll be preventing most issues.